Welcome to Not Your Ordinary Parts, a podcast where we talk about hard things associated with the human experience with the goal of increasing awareness, growth, and healing. You may hear information from professionally licensed therapists, life coaches, healers, doctors, etc. This information is not medical advice or therapy and is not meant to replace actual therapy or instructions given by a doctor or personal therapist. I'm your host, Jalon Johnson. My guest today is Dr. Erin Newins. Dr. Newins is a child psychologist who primarily works with children, teens, young adults, and parents. Dr. Erin specializes in anxiety disorders, providing neuropsychological assessment, and her main focus is on diagnosing and treating mental, emotional, and behavioral disorders. Dr. Erin received her bachelor's degree from Gonzaga University, her doctorate from Seattle Pacific University, and she's trained at several teaching hospitals, including Seattle's Children's Hospital and Dell Children's Medical Center. Dr. Erin uses science-backed treatment modalities to provide her clients the best, most effective care possible, and her goal is to give her clients tools to live life while feeling confident in their ability to handle any problem that arises. So, Dr. Erin, welcome to the show. Thank you so much for being my guest.
Thank you for having me. This is great. I'm
I
excited.
gave a brief description of who you are and what you do, but so that the audience can get to know you better, would you mind giving us a little bit of background about how you got to who and where you are today?
Yeah. Yes, definitely. I think, the journey to becoming a psychologist is always long and complicated. And I will say I got here with a lot of privilege, a lot of luck, and some hard work. Most people I think who are in the helping field are here because we want to help. And whether that's we wanted the help that we needed when we were young, or we wanted to help people that we couldn't help when we were young, there was something that got us excited about the idea of helping. And for me, it was wanting to help people, particularly kids. I really always loved working with kids. But then I really fell in love with the science of psychology, like this idea that we actually know why people do the things that we do and what to do about it. Like we have things that can help kids. We have tools, there's reasons, there's explanations. That was so cool to me, to be able to understand the science behind things. So that got me started on this psychology journey. And then really a lot of it is you take any experience you can get and you figure out what you love. And then you try to do more of that. And for me, it was working with kids. It started out, I actually worked more with kids with trauma and with kids with like big behaviors. And then it sort of shifted from that to more of kids with anxiety. And now I do a lot of anxiety work. And becoming a parent also makes parenting is so hard and being a kid is so hard, and there's so much. And so the two really intersected, is trying to be the best mom and the best person that I could be. And really like figuring out what that meant for me as an adult, and then how to translate that to how I can help other people really do the same in order to live really good lives. And that's what makes me excited every day. And then it gets to be fun. When you work with kids, we talk about soccer. My family's an avid soccer family. And then we're talking about Marvel, and I have games and Legos. And so we get to be fun and silly and just like live good lives. And I love that part of it.
That sounds so amazing. And I love the fact that you admitted that being a parent is hard.
Yeah.
And that being a child is hard. Now, if you mix in, difficulties that we have from our lived experience with trauma, or,
Yes.
if we're not able to feel our feelings because we have some sort of emotional disorder or what have you, it makes it even tougher.
So much harder.
Exactly. Thank you for what you do and for the kids that you help.
It's
and
really
the families too.
fulfilling. It's really fulfilling.
I'm sure.
Yeah.
Okay, so my first question, what's it like being a child psychologist?
It's really fun. I really do love what I do. I like I said, the science part of it, the part of trying to figure out every person that's in my room, everything about them, their thoughts and feelings and actions and histories and memories, and the system that they're in with their families and their schools and their environment, and sort of getting to untangle that with them is really cool. Getting to do that work. I get to be this like unbiased third party that comes in and gets to say, wait, hold on, you're doing this pattern that seems like it's not helping you. Or you're doing this thing that is really helping you. Let's do more of that. It gets to be kind of like puzzles that we're doing together to move people towards living really good, meaningful, values-based living. And it's hard, there's a lot, and there's a lot of things that are out of our control. Whether that is trauma and other people, and the schools are giving me a hard time right now with a lot of things. And so it's hard to feel like we're doing such good work and there's always more to be done. And I think for me, I use that as a place of motivation, getting to do things like this where we can maybe spread some awareness and, reading books and helping whomever I can that's coming in. It's this like motivating part that there's work to be done.
So, correct me if I'm wrong, but you were a psychologist first and then a mom, right?
No, I think I'd say it the other way
Okay.
around. I think I'm a mom first, and then a psychologist. Oh, do you mean like literally in the order?
Right, in the order.
Yes, sorry, yeah, totally. No, actually, I was, my son was 9 months old when I started grad school. So I learned both at the same time. I raised my first son through grad school. He's almost 11 now. And then we have a 2-year-old also. So we pre-grad school, post-grad school. No, so I learned it while I was doing it.
Okay, so do you think that because you learned it while you were doing it, it allowed you to be a better mother and a better psychologist?
I think looking back on it, I would say yes to that.
Mhm.
I think in the moment it felt like it was a lot. And I think it's important that I think anybody who's in the really any profession, but a helping profession would say it's very different for me to teach skills and work with kids that aren't mine, because there's a different emotional connection, right? I'm very emotionally entwined with my children, obviously. And also I'm the mom, so my kids don't want to listen to me. When I get to be the cool doctor, then the kids are more willing to listen and work with me. And at the same time, I definitely think that it allowed me more understanding, more empathy for what my parents that I'm working with are going through, or I can sort of relate in different ways. And I think learning some of the tools, I use all the tools in my own parenting that I teach 100%. And so I can really say, hey, this one really, really works. It's really, really helpful. So that helps my parenting in that way.
Nice. I was going to say, not that it's something that can't be done, but I would think that you would have more of an edge as a mother or parent working with kids, as a psychologist too, because you know what's happening. You've been there, you've done that. So it gives you, you're in the trenches, so to speak, with those parents because you understand what it's like to be a parent.
Yeah. Yeah. I mean, I do think that it's possible to be really fantastic. I know some people who are really amazing psychologists who don't have kids and they work really well.
Mhm.
And in some ways, there's benefit to that because there isn't that connection. They can really look at this family without their own stuff ever getting in the way. There's definitely times where I have to work a little bit harder to say, hold on, this kid in front of me has a lot of similarities to my kid, but they are different kids. We are different families. So just because I'm using a tool in my house that works, it might not actually be the right tool for this kid, even if there's similarities. So I think we have to work with that. And I think there's some value to not having that barrier, I think. And yeah, I've found more often than not that it makes me feel like I really can relate to these families. And I think vice versa.
Okay. So, I mean, I guess not to take anything away from either side, but
Yeah.
there's just value for anyone who's trying to help children.
Yeah.
And,
Yeah.
we all have our gifts and so on and
Yeah.
so forth.
Yeah. Yeah.
My next question is, how do children develop OCD?
Really good question. Yeah, because that's one of working with anxiety disorders. I see a lot of OCD. I see a lot of phobias. I see a lot of selective mutism, which we can talk about too. But I think I do see a lot of OCD, and I think one of the reasons is because it is a sort of nuanced. It's not just that we're worried about something; it's that these kids are anxious or worried or really afraid of something, and then they've developed this strategy to try to make up for it that actually doesn't help. That it's actually increasing the OCD or the anxiety, and so really you have to have like a specialized treatment to do it. If you're not doing evidence-based treatment for OCD, we can actually make OCD worse if we're doing like traditional talk therapy. So I think that's part of why I see so much OCD, because I'm trained in the treatment. And really, it's a lot of nature and nurture, right? With all mental health, we have genetic vulnerabilities, right? Like I tend to err to the side of defiance. Is my my vibe is a little bit more defiance by nature. Other people might have like tendencies towards depression or tendencies towards anxiety. And maybe that's because genetically we've got family histories of those things, or, early childhood experience, any of that stuff. And then often it's this combination of it being reinforced in the environment, which is usually done with really good parenting. If your kids are ever tantruming or having a big emotion because something is wrong, we're going to try to fix what's wrong, right? Because we want our kids to not be having these big meltdowns. And sometimes when we do that, we can accidentally reinforce the anxiety, because essentially we've just allowed our kids to escape from anxiety, which taught the kids that, oh yeah, that was really scary. We really needed to get out of that. And then we sort of get this snowball effect where then the anxiety gets bigger. So
Wow.
developing OCD is that sort of mix.
Wow. And for children trying to navigate and, learn their way just on, living in their environments and their relationship with their parents, they're going to always choose safety, I would think.
Yeah. Yeah. Yeah.
So if safety means learning a pattern that allows you to escape from anxiety, then they're just doing, the best that they can or what they know
Right.
how.
And it makes sense. I tell
Mhm.
families this all the time with OCD or selective mutism or other types of anxiety. When we've escaped the anxiety, you're actually doing what your body wants you to do. You're keeping yourself safe, right? You're effectively working, and
Right.
it's pretty smart. Like it's pretty logical for these kids to say, oh, this makes me anxious, but when I do this, I feel less anxious. So I'm going to do that. The problem is that then the safe, they weren't actually unsafe to begin with. The threat wasn't actually a threat we needed to escape, because anxiety is all about uncertainty. It's all about like what could go wrong, but it's not actually going wrong. So it's all this like what if, and then we're solving problems, and that gets really complicated. But yeah, it's trying to keep you safe when actually the message we want to send is, you don't need to be kept safe because you're brave and strong and you can handle this feeling and you can handle the situation.
Wow. Um, Anxiety being the fear of the what's uncertain. I think that, but also there is no threat. Like you feel there's threats, but there's no threats. Oh my goodness. When you
Isn't
think
that?
about it like that, it really it hits so hard.
Yeah.
That has got to be a loop and once you get anxious, I think that it just continues to grow. So it's just like that snowball effect. So,
Mhm.
and especially for children, oh my
Mhm.
goodness, man.
Mhm. Yeah. Yep.
You have a specific love, and I think you talk about ADHD a lot. What is it like working with children that have ADHD?
I do. It's my other, I work a lot. My kids are either the anxiety kids who are struggling with different kinds of anxiety, or ADHD. And a lot of times with ADHD, it's, gifted or smart kids that their brains are just working a little bit differently. And I think what I really love about it is a lot of times it's like a big capacity for knowledge also leads to a big capacity for emotions. So we have these big
Mm,
emotions and these big reactions, and with ADHD, the old metaphor they used to use is this like Ferrari engine and like a Ford truck, right? So we've got all of these things going, but we don't have the tools to navigate it or to manage it. So I think it's really fun to help kids with ADHD learn that's not a problem. There's nothing wrong with their brain. Their brain just is working a little bit differently than maybe the person next to them, which, by the way, everybody's does, right? Like everybody's brain is a little bit different. And so the job is your brain is really cool. You've got this really cool engine in your brain. We just have to figure out how to harness it and use it. And then it's skills training and it's helping parents see, the strengths and weaknesses there and helping us navigate these big emotions. I think that is really powerful and really fun.
I love the analogy you gave of the Ferrari
It's
ring and
not mine.
Ford.
It's somebody
I've
else.
never heard
It's
that one
someone
before.
else's. I'll see if I can find who originally said that.
I think that telling a child that who may feel like there's something wrong with them because their brain is, a Ferrari brain,
Yeah.
it would have to make them maybe shift and go, oh,
Yeah.
well, if that's the case, well, then that could mean that I'm special. And I
Yeah.
just have to figure out a way to, make
Yeah.
my specialness work
Yes.
in a world that maybe it is not designed for, or it doesn't work in, or
Exactly.
is not fit in. Yeah.
Yes. Because they've been told often, they're saying, I can't do this. It's hard. It's hard to sit and do homework. It's hard to listen. It's hard to remember. And the feedback that they've gotten is that they've failed. It's not that hard. Just figure it out. You can do it. Why can't you just do it? And they're like, I don't know. And so I think that teaching people about ADHD can be really powerful to help people realize that it's not a fault. It's a actual brain thing, first of all, and there's things we can do about it.
Hmm. I think that leads perfectly into my next question, because you also have a passion for working with kids who present with a variety of difficulties. What are some common difficult presentations besides ADHD and OCD that you see?
Yeah. I think the other thing that I'm doing a lot of work with lately is selective mutism, which is an anxiety disorder. My best friend is a psychologist who lives in Seattle and owns a clinic that just does selective mutism work primarily. And so I'm a contributing supervisor for her, and I do some work here in Austin too. Selective mutism is a clinical diagnosis where kids get this fear response to having to speak to people that they're not used to speaking to. And then it really it triggers this fear, fight or flight response. And essentially what happens is, have you ever asked a little kid, hey, what's your name? And then they don't answer. And rather than everybody just awkwardly standing and staring at the kid until they answer, somebody jumps in and says, oh, his name is this, right? When we do that rescuing, what happens is that it's that other snowball where these kids really learn that they don't have to speak and that it's too scary to speak. So someone else is going to help them. And so we end up with kids who aren't talking at school, like not a word with their teachers or their peers. And that's so problematic because then they're not learning how to learn, how to play, how to talk, how to have friends. They're missing all this learning because they're not talking. So it's more than just shy. It's a clinical fear of talking to new speakers. And so we do sort of a regimented treatment for it. So I see a lot of that along with OCD and ADHD are just kind of like big emotions I help kids with too.
It's funny how much the things that you're saying, like, I think about and I'm just like, wow, like, it was scary to be a kid. Like, it really was. And we didn't have a lot of these tools, and I just thought about the example you gave of somebody asking your name. And if you don't feel safe in front of that person or around whoever it is that you're around, you're gonna, you know, stay quiet.
Yeah.
But then if somebody jumps in and says your name, now you, like you said, you may learn that, oh, okay, well, I don't have to say anything.
Yep.
And then you may develop the feeling of safety in not talking. So now
Yes.
talking feels unsafe.
Yes. Exactly. Exactly. Yeah.
That's
And
so deep.
it is. And I think with all of these things, and really my ultimate goal in a lot of therapy is that the the message that's then sent is because something was unsafe and I have to keep myself safe. What's actually also sent is like, that also means that then I'm not brave. I'm not capable. I can't handle fear. I can't handle not feeling safe. And I think that's where, we're talking about something that is actually safe and that we are brave and we know these kids can handle. And I think the key that I always want to teach every kid that's in my office, every parent, every person in my office is we can handle all the feelings. Any feeling that shows up in your body, any thought that shows up in your brain, we can handle that. You are capable. You're brave. You're strong. We can do that without having to escape it. And so that's where we're trying to there's different treatments that do this in different ways. But a lot of the treatment and therapy is just, our thoughts and feelings are going to show up and we've got this. We can handle that.
Do you think that anxiety is different in adults than children, and why?
This is such a good question because I think at the core, no, I don't think it's different. Because if we think about anxiety and fear are the same-ish, where fear is a fear of a threat. There's a threat in front of you. I use the bear metaphor all the time. There's a bear on the path in front of me. Anxiety is a fear of a perceived threat, a could-be threat. What if there's a threat? What if there's a bear? Was that sound a bear? Was it not? The key is in that scenario, there isn't actually a bear. I'm just thinking about a bear, right? I'm just thinking about what if there's a bear, what would happen, what would go wrong. And then probably my brain is spiraling to we're all going to die right now because of this bear, right? But the anxiety is what if something is bad? What if something is scary? And just as a side note then, so in anxiety, we're afraid of a thought pops in and then we're worried about that thought. That thought brings up this what if it's happening kind of fight or flight response. Trauma is the same response, but to a memory instead of a thought. So it's a memory that's popped up that we're having this physiological response to, this fight or flight fear response. And of course, that's much more complicated, but we think about it's all this spectrum of the same emotion of fear, of something that we're afraid of. With kids, the content is usually a little bit different. But functionally, when I have somebody who's in my office who's dealing with an intrusive thought of something being contaminated, if we have contamination OCD or a needle phobia, if I have a needle phobia fear in my office, it's the same no matter what age you are. We're afraid of this thing that feels like a threat.
Wow. I am just having so many light bulbs
I know.
go off as you talk about this.
That's
Oh
my
my
experience
goodness.
too. When I learned all this, the psychoeducation piece of again, this is that science that I love so much of, oh, that makes sense, right?
Yes.
That's why my kid is doing that. Or that's why when that thought pops in, my stomach drops. It makes sense. It's not weird. If you're having those reactions, it's not weird. It makes sense to me.
And then also, if you grew up with caregivers who didn't necessarily know how to respond or address your big feelings or your
Yeah.
anxiety, you were told, buck up
Yeah.
or be
Stop the
tough,
emotion.
right? Stop the emotion. And another thing I learned that emotion wasn't necessarily bad or problematic. And it wasn't necessarily that you shouldn't feel it. It was that maybe your caregivers were uncomfortable
With
with
theirs.
the emotions. Yeah, exactly.
With theirs. Yeah. I
Man.
mean, I think it's not even just caregivers. I think we live in a society that really encourages stopping or getting rid of emotions. I tell
Mm,
this to kids all the time when I ask somebody to take deep breaths. It's always annoying because in schools, we're told just calm down, take a deep breath with the message of stop the emotion that you're feeling. Stop being so angry, just take a deep breath, just calm down. That's really invalidating and super unhelpful, right? No, I am feeling angry. So we have to figure out how to make room for it. And I think so often, previous generations weren't taught or told how to do that. And not even just generationally, some people just were never taught how to manage their own emotions. And so that's why nowadays there's so much emphasis when we're talking about parenting. And the first most important thing you can do as a parent is learning how to manage your own emotions so that in the moment you can manage your emotions and have them, it's okay, whatever you're feeling and thinking. We're sending that message to our kids too. It's okay, whatever you're thinking and feeling. How do we navigate that in a way that's going to be helpful?
It's funny that we're having this interview today because last night I was just talking to my friend and he sent me a text and he goes, "Yo, I got to share something with you." He said, I was talking to my daughter and I forget exactly what it was he said, but the message that she gave him was, "It's not your job to make other people happy." And she's 9.
Oh my gosh.
And I said to him, I said, "Could you imagine even having that
Connecting with that.
concept?"
Yeah.
And I said, I think that as the generations um, continue to learn more, there's more space for
Yeah.
the next generation. And I said, also, in the absence of trauma,
Mm-hmm.
there's more room to feel. So
Yeah.
her emotional maturity at 9 years old is probably the same as ours right now because we never got to that
Right.
point until later in life. But it was just
Totally.
mind blowing. Mind blowing.
I know kids these days, it's really wonderful in a lot of ways that there is more emphasis on allowing room for our thoughts and feelings, and figuring out how to have thoughts and feelings in a healthy, helpful way.
Agreed. Agreed. So we talked about this a little bit, but avoidance.
Yeah.
How do you feel about avoidance as it pertains to anxiety? And is it a good way of treating anxiety?
Avoidance with anything is not helpful because we're not actually learning how to manage it. I think the key of why avoidance is so important to recognize when it comes to anxiety is because it's what our body wants us to do. When we feel fear, our body goes into fight, flight, or freeze mode, right? When we feel anxiety, our body does the same, fight or flight. The fight is reassurance. It's trying to make sure things are going to be okay. Am I going to be safe? What it's going to be like? We're making sure, we're trying to find certainty that we actually can never really find. The flight mode is this like avoidance, right? Trying to get away from the anxiety. And the problem is when we're avoiding anxiety, we're sending this message that, yeah, you really needed to escape that. That was really, really scary. I usually draw this like thing where we say, the anxiety, when we escape anxiety, it actually grows. When we avoid anxiety, it's actually going to get harder. It's going to get worse because you didn't manage it. But if you think about it, if you had something like a social event that feels kind of stressful to go, and you decide not to go, okay, I feel better, until the next time you have to go to a social event, then it's even scarier, right? Because you didn't deal with it the first time. So our job with anxiety is, instead of avoiding, we approach in ways that are going to be helpful.
I like that a lot.
I think there's an alarm going off somewhere.
uh, my next question I wanted to ask is, what is neuropsychological and psychological testing?
Yep. Again, we can come back to the science part of this, right? What's the science that we're dealing with? And neuropsych testing is objective testing to try to figure out what's going on in somebody's brain. IQ testing, we're testing for ADHD. Sometimes we're testing for autism. It's like testing for what's going on in your brain, how your brain is working. Psychological testing is the same. It's just, instead of it being so neurological, like so IQ, psychological testing is a little bit more about what diagnosis are we doing, essentially. Is this OCD? Is this generalized anxiety disorder? Is this depression? What's going on? I really love when we have testing on board, because if I have somebody that comes into my office and I'm not doing objective testing, then it's 100% just my brain to try to decide what's going on with this kid. And, I trust my brain, and my brain only knows what my brain knows. And that's not enough. I have to be consulting, and I have to be reading, and I have to be asking, and I have to be making sure that I'm not missing something all the time. Objective testing gives me data that didn't just come from my brain. So it gives me a little bit more room to really have data to back up. I think this is ADHD instead of anxiety, or vice versa.
Wow, I like that. And we talked about this a little bit too. And I think with all of the information that we're discussing, and anxiety and, maybe not knowing or not having all the tools to get through parenting or dealing with your kids. And we established that parenting is hard.
Yeah.
That was a lot to try and get to that point. But just because parenting is hard, if it feels hard, does that mean that you're necessarily doing something wrong?
I think if it feels hard, it probably means you're doing something right.
Hmm.
I think that's what we would say. And that's what's on all the Instagram, TikTok things is like parenting feels hard because you care. Parenting feels hard
Hmm.
because it's important to you, because you want to make sure you're doing right by your kid, because you want to make sure that we're setting them up for success. My kid is starting to enter, I have a toddler and I have a preteen. And so
Wow.
it's
Both ends of the
always,
spectrum.
oh my gosh. And every decision is like, there's pros and cons to this and what's going to be the best option. And I think when it feels hard, it means that it's important and that we care.
So is it normal to be anxious as
Yeah.
a parent?
Yes. Yeah, for
Mhm.
sure. Right. Because it's our responsibility.
Mhm.
This is like somebody's childhood. This is somebody's life. This is somebody's future. Somebody's well-being is in our hands. And of course, it's not really, right? Like we don't actually have control. I don't have control over what my son's brain is doing ever. Nor do I have control over what his body is doing, his feelings, Um, and so it's more complicated than that. But I think anxiety kind of comes with it, that, it's our job to keep them safe. And there's so many things. And it would be like the worst thing, something happening to your children that brings up so many feelings and physical responses just thinking about it. So anxiety, again, just means we care and we want to keep our kids safe.
Nice. And I think that maybe for first time parents especially, like you kind of have no clue
Yes.
of what's going
Yeah.
on, and
Yeah.
maybe you try and look at, okay, when I was a kid, what did my parents do, or what things that I like or dislike, but it doesn't help. I mean,
No,
it's just there's what is it saying? There's no book on how to be a
there's
parent or
no
something like
book.
that.
There's no rule book, but there's 100,000 different opinions, right? So
Oof.
everywhere you go, there's parenting, there's mom blogs, and there's parenting books, and all the child psychologists are saying something a little bit different, but kind of the same. And, there's polarizing opinions on certain things. And so it's really hard to navigate. It's really hard to navigate um, how to parent effectively. It's complicated.
Mm, I agree. What are some compulsive behaviors associated with parenting, and what is usually behind the compulsive behavior?
I think, okay, I love this question. I think this is so important because I think that there's two things to keep in mind. One is that if we know that parenting is really hard and it's emotional and you're emotionally involved in the decisions and there's anxiety that comes up with it, I think it's really important to know that like parenting in itself can trigger mental health, right? Because it is this big life changing thing, becoming a parent. And so rates of parental OCD and particularly maternal OCD are really, really high. So there are situations where there's compulsive behaviors that are clinical that I would say we need to get support for, right? We need to figure out how to parent. And again, I think the key is when we're doing compulsive behaviors or any sort of behavior to try to solve the anxiety, like checking the baby monitor consistently or checking to make sure you know where your kid is, or asking multiple questions about where your kid's going to be, or all of these things that are all about keeping our kids safe are all about this anxiety of what could go wrong. And I think what's really important in walking the line, we talked earlier about navigating our own emotions as parents. I think the key, this is like the second key to therapy for everybody. The first key is learning how to have your emotions and how to feel our emotions. But the second key is learning how to have our emotions not be in charge. Our values get to be in charge. What's important to us? What kind of mom do I want to be? What kind of parent do I want to be? What kind of decisions do I want to make? What kind of lessons do I want to teach my kid? And there's flexibility and there's bravery and there's approach and there's problem solving and trial and error. All of that has to exist. So I have to leave room for that. And when we're doing behaviors with our anxiety in charge, then our values don't get to be in charge, right? Our anxiety is in charge. So I think if you catch yourself doing something in like I have to make sure everything's going to be okay, that might be our clue to say, wait, hold on, I think my anxiety might be in charge here. And I don't know that it needs to be, because everything is okay. And if something isn't okay, we're going to solve that when it comes. You know what I mean?
Wow. Do your parents like send you gifts every day? Oh my goodness, you make me like feel so at ease about, number one, my childhood experience. It's validating. And then also being a parent as well. Like, I wish everyone could hear what you have to say about parenting and child raising. It's so good.
Thank you so
Thank
much.
you.
I take that very seriously. That's an honor to hear that. Thank you.
You're very welcome.
It's fun. It's fun work.
All right. My next question I wanted to ask is, if parents are having a difficult time communicating with their kids, what are some ways to open the lines of communication and get their kids comfortable talking?
Please, please, please get rid of the lectures. When we do serious sit down conversations, that feels terrible. That feels aversive to everybody, right? I think the key with conversations are keeping them casual, brief, and frequent. I really love, like, seriously, when you have to talk about your kids, when you have to talk to your kids about something hard, think about what that conversation is going to feel like. And our ultimate goal is we want our kids to talk to us more, right? My oldest is pretty private and sensitive to embarrassment, right? And so I really need to make sure I'm reinforcing him talking to me. And so I want to make sure that when we're having hard conversations, we don't leave with a feeling of like, oh, that was horrible. I don't ever want to have that conversation again, right? That's not going to be helpful. So we try to make the conversations more casual and fun. And I think a really easy way to do this is making them brief, like kind of drop little statements here and there. They can be little validating statements or little like, I wonder what that would be like for you. And then we can kind of leave it at that. The other thing is, when you have to have serious conversations, have them in situations that are a little bit less intense. Like, a really good time to have serious conversations is to go for a drive or a walk, because you're not sitting staring at each other. You're doing something else that's a little bit less intense. So you can be, talking while you're not looking right at each other, but you're still together and with each other. I think the other key is keeping in mind that a lot of times as parents, our urges to teach, to correct, to direct, to counsel, to advise, right? So we're doing a lot of giving. We want to make sure that we're getting from our kids, right? That we're hearing where they're coming from, that we're really understanding their perspectives. So if you can start everything with something validating, something of like, what is this like for you? I hear you. I believe you. I'm with you. It's like that for me too. Or it isn't like that for me. Interesting. Okay. We're allowed to have different experiences, but making sure that your kid is a part of the conversation is key.
Wow. If you're giving any lectures anytime soon, I want to go.
I'm working on more like on-demand things of workshops and stuff. Yeah.
Your advice is amazing.
Thank
And
you.
I think it takes something that's so hard and it just breaks it into these little palatable, small pieces that are easy to swallow. And it breaks up. I remember when I first sent you the episode title, How to Be a Better Parent. And you were like, ooh, that's hefty. But
It is.
you knocked it out of the park already. We're not even done yet. And something I was thinking when you were saying that is, as a parent, there are times when, like, because my son is quiet and he's just being him.
Yeah.
But him being quiet makes me uncomfortable because I feel like he should talk more. He should do this. He should do that.
Yeah.
So listening to you, I realize that I'm trying to manage my emotions by getting him to be somebody that he's not, which, oh man.
Yeah. We can practice being like our kids and coming from, what they're like, matching their experience and their energy, and just really trying to see things from their shoes, which I think we all do as parents, right? I think we all value or want to value our kids and where they're coming from. And it's such a weird relationship because we're responsible for them in a lot of ways, and we need to teach them these lessons, but also they are their own unique people and they have the right to be their own unique people. It's complicated.
I think what makes it tough is because for, let's say, 10 years, you basically are doing everything for them, and they
Yes.
don't necessarily have a defined, developed personality yet.
Yep.
So once they start to come into their own autonomy, it can feel threatening.
Yeah. Yeah, for sure. Yeah. And it's, I think every stage in raising a kid is like a different relationship because you
Yes.
have different roles, and we have to figure out how to fluctuate as our kids are growing and changing. And then we're also trying to navigate our emotions and also get them to school on time. And, there's all these different things. And I think for me, I always come back to what are my overall goals right now? Like, what are my big values? What are my big picture goals and values for my kid and my family right now? One of them that I've said before is continuing to get my kid comfortable talking to us. I want him to be open and talk to us. And we're at the age too where we're trying to build his power, his responsibility, his ability to make choices and autonomy, right? So in any decision that we're making, there's all this, what if this is right? What if this is wrong? We want to come back to those goals and values. Like, how am I moving us in that direction? I feel like makes it a little bit less stressful because you have a big picture idea in mind. And then there's lots of ways we can get there. There's lots of room. It's every one little decision isn't make or break. It's about this big picture.
I love that. Something you aim to do is to help your clients get back to living their fullest and most satisfying lives without anxiety, frustration, sadness, or behaviors getting in the way. How do you do that?
I mean, I think that a lot of it is, it's the without them getting in the way piece. People come into my office and say, I want to feel better. I want to be less anxious. I want this thought to go away. And that's not a thing. It's not possible. If we could do that, if we could just wave a wand and feel better, or like snap our fingers and have thoughts not bother us, we would have done that, right? The key is instilling this sense of, we can tolerate these things. We can handle this. We have skills. We have tools in us already that we can manage any thought or feeling that comes up. So I think it's a lot of this mix of, how do we feel our emotions, right? Like we've already said, this one piece is, how do we feel frustrated and know that it's okay to feel frustrated, and know what thoughts make us feel frustrated, and know what frustrated feels like in our bodies, what our action urges are when we're frustrated. Knowing all of that, and then figuring out how to live and make choices without the frustration being the boss, where we can be frustrated and know, I'm frustrated right now, but yelling isn't going to get me where I want to go. So instead, I got to do something else so that I don't yell, right? Or I'm anxious right now, but going to that thing is actually, this is important. That's values consistent. So I'm going to go and I'm going to do whatever I need to do skills wise to get myself there. I think that's the balance, is a lot of normalizing emotion, a lot of leaving room for emotion, and a lot of reminding kids that their emotions don't have to be the boss, that they get to be the boss no matter what emotion or thought is coming up. It's so cool. Gosh, I do this like, I have to keep this in mind for myself too. Of like, okay, hold on. The emotion just showed up. It's okay. I can handle that.
You know what I immediately thought and felt when you said allowing your kids to remember that they get to be the boss? That was never a thing. Like,
Right?
it was, I'm the parent, you're the child.
Mm-hmm.
So I was never able to step into my own power per
Yeah.
se. and be comfortable being me, because I always had to remember my place.
Yep.
And my place didn't allow me to always necessarily have a voice.
Yeah.
So
Yeah. And so
I
then
think that
thoughts
may
and
be
feelings
difficult
just
for some.
happened to
Yeah.
you.
Hmm.
It's like
Right.
everything just was happening to you, and you didn't realize and learn that you get to participate in that. Right? Like our thoughts and feelings are just going to show up. Sometimes thoughts just show up and we have no control over it. And we are also there too. We can bring other
Hmm.
thoughts onto the table also.
Yeah. That's important advice. And I think, like we were talking about, as we get more information and knowledge on how to be emotionally mature, every generation that follows is going to have a little bit more room to develop and be more emotionally stable. So I think it's important to recognize that it may not be a thing, the ways that we can make it a thing, and then how to recognize it and praise it when it does become a thing.
Yes. Yes. Yeah. Cause like you were about to say too, I think, a lot of parents never had the opportunity to learn all of this, to learn how to do
Mhm.
this. And so they're trying to learn that now as they're also trying to teach it to their kids. And it's hard. It's hard.
And then sometimes, like, and I say this, and I'm a little embarrassed to say it, but it's my truth. Like, I see my son in his power, completely comfortable. And sometimes I get like a little like, that's not fair. Like,
Totally.
but
Yes.
then I also have to realize that I did my job.
Yep.
If this is who he is,
Yep.
and this is the comfort level that he is, then I should be proud that he has
Oh,
that. And it shouldn't, I mean, I can't dictate how I feel about a certain thing. I'm just going to feel that way.
yes.
But what I can do is feel it, recognize it, and then step back and say, okay,
Yeah.
what's happening? How do I, when I get this feeling, try to avoid being activated, and then
Yeah.
recognize that this is probably what should be happening.
Yeah. That's huge. That's huge. Yeah. That step back skill of what's showing up right now and what do I want to do with it is really important. And I think, it's all good information, right? Of like having those emotions towards our kids is totally like, I did my job. And I wish that I had that too, right? There's
I want to
room
be
for
you.
both. Yeah. There's room for both. And so
Yeah,
then it gets to be though
duality.
a cool of like, okay, and so what do I need now? Like how do I get there now? Because the journey doesn't end when you've grown up, right? You get to say, okay, well, I need more of that in my life. And so how do I get there?
Well, that was great. I really enjoyed this conversation, and I think that, like I said, you hit a home run with showing how to be a better parent. And if this is what you do every day, I'm sure every client that sees you knows that you are there for them, to advocate for them and give them tools on how to do it, and they're benefiting from it. So thank you so
Thank
much.
you. Thank you. I should have my kid listen to this because he doesn't always think so. And that's okay too. He's like, Mom, I'm not listening to you. Your skills don't work on me.
That's always the way it is. So,
Right.
all
Yep.
right, last question I want to ask, and this is a big one. If you could use your platform for anybody who may be struggling with parenting, their big feelings, anxiety, or just wanting to talk to someone and maybe not knowing how to take that first step, what would you say?
This is such a great question. I think, what I come back to all the time is this really simple idea that is complex, but there's stigma about mental health and about asking for help. And there's this idea that if you're asking for help, there's something wrong with you or you failed. And really actually the key is that everything is harder alone. Like it's always harder to figure out how to navigate your emotions and your thoughts and your feelings. That's what we've been talking about, right? As kids, we might have been left alone with our emotions and our feelings and our decision making. And that was really hard. That meant we didn't figure out how to do it. Now you don't have to be alone in it. We have these tools and these skills that can help, that can make things easier. And reaching out to find them doesn't mean you failed. It doesn't mean you didn't have them. It's just that we can do this together. Everything is easier together. Everything is easier when you have support. It would be silly to say, I'm going to do this all on my own, right? Because everything is harder alone. So I think if there's things that are going well that could go better, or there's things that I'm not sure how to do this, getting somebody else's brain in there to support your brain and your experience actually is just a really wonderful thing to do, and really can be so powerful. So I think that's my thought for you is everything's harder alone. And if we can have a team and we can have support and we can have help doing something, it's just going to be that much easier. And especially if the support is like science-based, right? I just happen to have a set of tools from my bookshelf and from other brains that are smarter than mine and have been doing this longer than mine. We have these things that can make life easier for you. Come take them, right? Let's do this together.
Wow. That was so good. So good. That was some really great advice. And I hope anyone who listens to this takes you up on that, because without community or without someone to help pick you up when you're down, like, what really do you have?
Right?
And if you're doing it alone, then you don't have anyone to challenge your thinking. You could be thinking something and it could be totally in left field, but there's no one there to tell you that's not true.
Yeah. Or that totally is true, right? That you're spot on. Keep doing what you're doing. I think we just, it's okay to be doing things with people. You don't have to do it alone.
So true. All right. Well, Dr. Erin, thank you so much for this. This has been literally a pleasure. I love listening to you. I'm going to listen to this myself a few times. I know it. So I just wanted to say, I really appreciate your time for doing this with me. We finally did it, because I know we've been waiting for a bit, but I appreciate you seeing value in what I'm trying to do and for taking part.
Yes. Thank you so much. This has been such an honor and a pleasure talking with you.
Same. If people want to find you online or on social media, where can they find you?
Yeah. My social media right now, I think it's at Dr. Erin PhD, Drerin PhD. I'm in the middle of a website rebrand. My company is currently called Pediatric Treatment Group. So you can find me there, but be on the lookout for Brave Austin, which is coming.
Nice. All righty. Well, again, thank you so much for your time. Thank you for what you do. Thank you for who you are and for the way you do it.
Thank you so much. Thank you.